Hello, welcome to another edition of Ad Hoc Virtual Cases. The case for today is a very interesting case. He had a twist in the end and then we had to change our treatment, and the improvement in the patient was well next to a miracle. This patient was a 68 years old male. He was from urban India. He had diabetes and hypertension for a number of years. He presented to the emergency room with a convulsion and weakness on the left side of the body with slurred speech for the last 3 hours. On examination, his BP was 170 over 100. His oxygen saturation was 94%. He had weakness on the left side of the body. The upper limb was more than the lower limb, but it was around grade 4 power. He had a distinct slurred speech. Our provisional diagnosis was a left-sided hemiparesis. His investigations were done. The hemogram was normal. The liver function, renal function tests were normal. His sugar was 240. His ECG and X-ray was normal. The brain scan showed a bleed in the parietal lobe, a very small bleed of 2.4 into 1.2 centimeters. So we then started him on treatment for the stroke. His sugars and his blood pressure was also controlled. He was shifted to the wards. In the further course in the hospital, the patient was stable over the night. But the next morning, I received a frantic call from the ward resident. He is telling, patient is semi-comatose and has to be shifted immediately to the ICU. We reached the patient's room in the next few minutes. When we saw the patient, he was definitely very drowsy. He was responding just to a few of my commands, as you can see in the video. Chalo, Bimal ji, उठो आप. बिमल जी उठ गए कि नहीं? बिमल जी, he's sleeping. We did his oxygen saturation was just 86%, so that had dropped, and he was worse than what he was yesterday. But something was not fitting right into the diagnosis. We were missing something. What was not right? Point 1. Why should a person with just a small bleed of 2 centimeters become so drowsy unless the bleed has increased in size? Point 2 was why the saturation was 94% yesterday fell down to 86% with a normal chest X-ray. And 3, as you can see in the video, when I was talking to the person, even though he was very drowsy, he was snoring in sleep as if he was in deep sleep. So we thought, are we dealing with some obstructive sleep apnea syndrome, or are we dealing with a sleep apnea? So we sent for his blood gas. That also showed a PO2 of 50. So we put him on oxygen, we put him on IV dexamethasone. By evening he was much better. He was more alert. He had his dinner. The next morning, as you can see in the video now, he's responding to all my commands. He answered all my questions. He was sitting upright in bed. He had his lunch, he had his breakfast. He did well.
Yes.
How are you, sir, now?
I'm fine, sir.
How are you? Do you remember how you came to the hospital?
Yeah.
You remember everything?
Yes.
But you were sleeping for the last 3 days.
No, but now I'm awake.
Now you're awake. Now you eaten some breakfast in the morning?
Yes.
Huh?
Yes.
So you're feeling better also?
That's right.
His oxygen saturation was 93% even without oxygen. We then realized that we are dealing with a sleep apnea syndrome. So we did the sleep apnea study on him that night, and that clearly showed a very severe case of sleep apnea syndrome, obstructive sleep apnea syndrome. We continued our treatment. The next day the patient was so better that he was walking in the wards. He was alert. He was absolutely normal.
क्यों? नहीं, क्योंकि मेरे को मालूम नहीं है, but I wanted to go.
You want to go? You're feeling good now?
Yes.
You're feeling fresh?
Yes.
And you don't remember how you reached the hospital?
No.
Or you remember?
No, I don't.
You don't remember. But you're feeling that you can go now, right?
Yes, yes.
Chalo, enjoy your stay at home now. Okay?
Thank you very much, sir.
Bye bye. Take care.
I'm very grateful to you, sir.
Okay.
Very grateful to you.
The patient was discharged a couple of days later with a final diagnosis of left-sided hemiparesis due to intracerebral bleed with the obstructive sleep apnea syndrome. What is the take-home message in this case? What did we learn in this case? We learned that if there is a new sign or symptom in a patient and it is not fitting into your original diagnosis, always think of other possibilities. In this case, though the patient was admitted with an intracerebral bleed and he had a mild hemiparesis, but when they became very drowsy, it was the bleed, we could not explain the drowsiness because of that bleed. This is how we thought of a diagnosis of a sleep apnea syndrome. And after starting treatment for the sleep apnea syndrome, see the improvement in the patient. So the right treatment given at the right time, a patient can improve dramatically, which is close to a miracle. I hope you have enjoyed this case. And for many more such videos, please stay tuned on to High Doc Virtual Cases. Thank you.